Dr. Nicholas Mercer with uImproved PT. Today I wanted to show you an exercise that you can do at home to prevent and decrease any back pain that you may feel throughout the day. A lot of people's back pain is due to hip weakness, especially the gluteal muscles in the back of your hips. So I'm going to show you a simple exercise that you can do to activate and start to strengthen those muscles. It's called the hip bridge. So all you're going to do is lie on your back with your knees bent, your back flat on the ground, hands by your side. You're just going to lift those hips up. Feel a strong contraction in your booty right here. You can even spank your booty a little bit. Make sure it's squeezing. You're going to hold 1, 2, 3. Slowly come back down. Up again. 1, 2, 3. And slowly come on back down. Now, some common problems people have during this exercise are some hamstring cramping, especially if you've never performed this exercise before. So if you do end up having some cramping in the back of your leg here, whichever leg is cramping, just straighten it out. Let that cramp subside a little bit. Once that cramping stops, bring that leg back up, and then you're going to point those toes up and try the same thing that should shift more of the weight and the contraction into your hips here so your hamstrings don't spasm and cramp up. All right, so that's the first one. The second one is a lot of people may have some increase in lower back pain when they do this exercise. So in order to help decrease that pain, we're going to regress this exercise. So instead of bringing the hips up, we're just going to focus on contracting the lower abdominals by pushing the lower back into the floor. And when you do that, you should feel the muscles down through here squeezing. You'll hold for 3 seconds and then relax. All right, we'll do a set of 10 of those. Push that lower back in the ground. Hold 1, 2, 3, and then relax. And then you're going to try the bridge again. You're simply going to first activate the lower abdominals to give your lower back some stability. And then once we get that, we're going to keep that contraction in the lower abdominals. Lift those hips up. Hold 1, 2, 3, and come back down. If that's still causing you pain, especially in the higher ranges, you're going to slowly work up to it by still getting that small contraction and then just lifting those hips up to right before you get that pain, holding 1, 2, 3, and come back down. So for instance, if I come up and I get pain right here, I'm going to come back down a little bit and hold right there, trying to squeeze my glutes. Again, you can spank your booty and then come back down. All right, so those are some simple ways that you can modify that bridging exercise. But throughout the day, getting that activation and that strength in your hips will support your lower back when you're standing, and then just modify that exercise based on what you're feeling, if you're cramping, if you're having some lower back pain while doing that exercise. And if you want any more information on how uImproved PT works with our patients and how to get back to the activities you love without unnecessary surgeries, injections, or pain meds, feel free to visit uimprovedpt.com. Schedule a free phone consultation where we can kind of get down to the root causes of what is probably causing your back pain and how we can find a long-lasting solution for your pain relief.